My name is Charlie, and I've helped over 150 people win their PIP claims, and I received PIP myself. If you suffer from depression, anxiety, PTSD, CPTSD, what they want to see is, are you doing something to help yourself? Now, a lot of people are going to hate me saying that, and DWP have never said that. I can see a big difference in cases where people are really trying to help themselves. So if you have been on the same level of medication for a while and you think, well, there's no point in going to the doctors because it doesn't make a difference, you need to get your ass to the doctors. Okay. The GPs, they have to follow a certain procedure. So a lot of you with fitting in the mental health category will need treatment. Okay. Now, it's been scientifically proven that talking to the right professional, the right level of professional, is as effective as medication. Now, personally, I'm not a medical professional. I believe that sometimes there are cases where meds are needed. It's so severe, or it's been ongoing for so long, we need a combination of both. You need a combination of both, right? So the GPs can't just send you to a psychiatrist. Psychiatrists are specialists. Psychiatrists can prescribe different medications than GPs can. Psychiatrists will make it unique to you. GPs, general practitioners, will give you the general medication that seems to do the best for the most people. They're a great starting point, but if you think you score in mixing with people because of severe depression, severe anxiety, PTSD, CPTSD, you need a professional. You need a specialist. Okay. So to get to the specialist, if you're going through the NHS, the GP, depending on the severity, the GPs have to follow procedure. So they might have to send you to CBT first. They might have to send you to talk therapies first, because they've got to tick those boxes to then go, actually, this hasn't been effective. Now we can go to the next level. They have to follow procedure. Okay. So if you're I work with people where I explain that to them, and these are people that have experienced significant trauma. Having a chat about trying to think positively with an individual that doesn't have much life experience, that is basically following a set process that they need to get through in that meeting, is not going to cut it. Okay. But they have to go through that to get to the right level of specialist. Okay. And I have experienced it where the individuals doing the talk therapy and the CBT have then contacted the GP and gone, this person, this is not enough for this person. And then we've got that in writing and used it in PIP because it was a dog's bollocks as far as I was concerned. So I need you to remember, you are worth fighting for. You are entitled to a reasonable quality of life. There's so many people that have given up on treatment, and there's also a lack of understanding that when you go to the GP, if you're suffering from depression, anxiety, and they start you on medication, they'll start you on a loading dose. So many people that I've spoken to in the past, and I'm sure I will in the future, will go, well, it doesn't work. And I'm like, what are you on? What dose is it? And I'm like, that's okay. That's like the introduction level. Did you tell your GP that you didn't think it was working? Well, no. And I'm like, right, you can get that medication needs to be increased. You've got to find what works for you. So but I just need you to fight for yourself. You need to fight for yourself to obviously get PIP, and you need to fight for yourself to improve your quality of life. That then reflects in your PIP form. Okay? So please listen to me on this, okay? And when I work with clients, this is the main thing. Yes, PIP is important, but PIP adds to your quality of life. That's the goal. My goal is always improving quality of life. Only you can do that. You have the power.